I now have the pleasure of welcoming Angela Zangari, Executive Vice President of Finance and Operations, and the Executive Lead for the South Niagara Project to bring greetings on behalf of Niagara Health. Welcome, Angela.
Thank you, Mary Jane, and thank you to all for joining us this evening. Before we begin, I would like to acknowledge that the land on which each of us gather is the traditional territory of the Haudenosaunee and Anishinaabe. This territory is covered by the Upper Canada Treaties, is within the lands protected by the Dish with One Spoon Wampum Agreement, and is directly adjacent to the Haldimand Treaty Territory. Today, this land continues to be the home of many Indigenous peoples. Acknowledging ensures we reflect on our past and what changes can be made going forward to further the reconciliation process, and reminds us that the great standard of living that we enjoy in Niagara is directly related to the resources and the friendships of the Indigenous people who make up our community. So thank you once again. So over the course of this session, we will be providing an update on the progress of the South Niagara Hospital. We will be going over the project's milestones and project timelines. We'll give a brief overview of our focus, our goal of becoming well certified, and an overview of the project. We are joined today by our colleagues at Infrastructure Ontario, who will be informing you on the request for qualifications and request for proposal process and future opportunities within the South Niagara Hospital. Infrastructure Ontario will also be discussing the benefits of the public-private partnerships, or also known as P3 model. The South Niagara Hospital brings a significant investment from the Ontario government to Niagara. With the construction of the new hospital, there are opportunities for Niagara businesses to have direct benefit. This session is intended to start the conversation and provide information as to how your business or company could benefit in the future. It is now my pleasure to welcome Cliff Harvey, Chief Planning Officer for the South Niagara Hospital Project, to give an update on the progress of the new hospital. Over to you.
Great. Thank you, Angela. And thank you to Infrastructure Ontario for joining us here. And thank you for everyone who's online joining us for the webinar. It's my pleasure to be the Chief Planning Officer for this project and working with great teams both at Infrastructure Ontario, the hospital, the community, and the Ministry of Health. The South Niagara Project's focus and project goals were developed after extensive engagement with our staff, physicians, patient partners, and the community. The project will be focused on creating a community of connected care and advancing healing. And by doing so, we'll be working towards transforming your experience in healthcare. The South Niagara Project is working towards being the first well-certified healthcare facility in Canada. We're very proud of this journey to be becoming the first well-certified hospital and working closely with the International Well Building Institute. WELL certification is recognized worldwide and features concepts aimed to improve building design, operations, and the overall experience by promoting the health and well-being for all those who utilize the building. WELL certification has proven results in improving the health and well-being for all those who occupy the building, attracting and retaining employees, basically increasing productivity, reducing absentees, and increasing job satisfaction. More information on WELL will be forthcoming with opportunities to provide input and become more engaged in the process. The project goals for the South Niagara Project were developed on, were developed based on the Niagara Health Strategic Plan and in collaboration with our staff, physicians, patient partners, and the community. Each goal assists in decision-making in the planning and design for the South Niagara Health Project. And our goals include patient, family, and staff experience, operational excellence, environmental leadership, connectedness, accessibility, inclusiveness, and all in the means to create a building which is adaptable, flexible, and responsive. You can go to our website actually to read more details on these project goals, which are significant in creating a project that will meet the needs of the community. At this point in the planning process, we have resubmitted our stage 2 to the Ministry of Health for approval. The coming months of planning are critical in terms of your input and engagement. Stage 3 defines the scope of the new hospital project in great detail. It's typical for an organization like ourselves to be working closely with the Ministry of Health to seek approvals while at the same time moving forward in the planning to meet the project schedule. What you're viewing on the screen are the important upcoming milestones of the South Niagara project. These are dependent on the Ministry of Health approvals, and these milestones assist to ensuring that we are on schedule for all aspects needed for when we open the facility. Particularly today, this information session will have Infrastructure Ontario speak to the request for qualifications released in early 2021 and the request for proposals set to be released in the fall of 2021. The next couple of slides are going to give you a quick overview of the project at a general level. The South Niagara project is located in Niagara Falls at the intersections of Bigger Road and Montrose Roads. On the slide, the road that's closest to us at the bottom of the slide is Bigger Road, and the one that's running directly from across the site is the Montrose Road. And in the background, you can see the towers of Niagara Falls itself. The intersection of Montrose and Bigger are just off of the QEW, and the size is approximately 50 acres. Niagara House is proposing an 11-story building with primary access from Bigger Road. The site features include a proposed on-site transit hub close to the hospital's main entrance, and outdoor healing spaces and gardens. The hospital itself will boast approximately 1.25 million square feet of care, which is larger than the St. Catharines site. It's very important to note that at this preliminary site plan that you see on your screen is conceptual and for illustrative purposes only. It will be subject to change. Listed on this slide, and you can also find it on our external website, are the programs and services to be located at the South Niagara Hospital. The South Niagara Hospital will have a seniors focus embedded in all aspects of the patient care experience. The project involves or includes the creation of Center of Excellence. We'll have a Center of Excellence for regional stroke, specialization in complex care, geriatrics, geriatric psychiatry, and wellness and aging. The Center of Excellence is a specialized program with a high concentration of expertise and resources, much like in our Walker Family Cancer Center and our Women's and Babies Unit at the St. Catharines site. I would now like to welcome Bruce Gray and Adele Nikhil from Infrastructure Ontario to inform us about the procurement process and talk about the benefits of the P3 model. Over to you, Bruce.
Great, thanks a lot, Cliff. Good evening, everyone. I wish I could see everyone. Different format. It's a pleasure to be with you all, even in this format tonight. My name is Bruce Gray. I'm the Senior Vice President within our Project Delivery Group at Infrastructure Ontario, and I look after the healthcare portfolio. Really happy to be here today, along with my colleague Adele. We're excited to work with Niagara Health to build this Canada's first WELL-certified healthcare facility in the country, which is obviously very appropriate for a healthcare facility. And maybe we'll just jump into the next slide. So maybe I'll just give you a bit of a background into Infrastructure Ontario, if you haven't heard of Infrastructure Ontario, or sometimes referred to as IO. We are a Crown agency owned by the province of Ontario. We provide a broad range of services to support the government's initiatives to modernize and maximize the value for public infrastructure and realty, so across the province. As an agency, all of our business lines uphold the province's commitment to renew public services in partnership with the private sector. Next slide, please, thanks. So this is where, in particular for this project, the P3s or the public-private partnerships come in. Throughout the process, you're going to hear the project referred to as a public-private partnership or a P3. For those who may be unfamiliar with this model, P3s are an innovative way of financing and procuring large infrastructure projects. It makes the best use of the private sector resources and expertise to provide on time and on budget project delivery. It's generally suitable for the larger and more complex projects, and that's why South Niagara Hospital is being delivered as a P3 project. Under this P3 model, the public sector establishes the scope and the purpose of the project as we would with all traditional projects. And while the design and construction work is financed and carried out by the private sector. In some cases, and is the case with South Niagara Hospital, the private sector will also be responsible for maintenance of the physical building once it's constructed. The P3s provide an opportunity to allocate and transfer some of the project risks typically retained by an owner, and this is in regard to design, construction, financing, and maintenance, to the private sector, who are many times best able to manage those risks. By allocating these risks to the private sector, it commits to delivering the project on time and on budget. The P3 model helps to ensure a faster project delivery and reduce delays on infrastructure projects generally. IO's P3 process is a fair, open, and transparent procurement and construction process. Just a bit of an overview, a bit of statistics on our history. So since 2005, Infrastructure Ontario has been assigned a number of projects, 132 listed there with a great value. I will note that we've completed our 49th healthcare project just last month, which was the Centre for Addiction and Mental Health, CAMH's 1C project in Toronto. And you can see sort of from the completed and under construction projects in particular, we've got a long track record of projects delivered within the province for all the clients and stakeholders. And so this is a very tried, tested, and true model, and it's been a very successful program delivery. And with that, with the statistics, I'll now hand it over to Adele, who will talk a little bit about the P3 procurement process for this project and some of the timelines that are overlaid on those processes. Adele.
Thank you, Bruce. Good evening, everyone. My name is Adele Nikhil. I'm the Director of P3 Delivery at IO, and I will be actually the project lead for this project. In early 2021, Niagara Health and Infrastructure Ontario will be issuing actually a request for qualification. We call it RFQ, for teams to design and build, finance, and maintain the South Niagara Hospital using the public-private partnership. We call it P3 model. The RFQ submissions will be reviewed to pre-qualified teams with experienced personnel, financial strengths, and design, construction, and facility management experience necessary to deliver a project of this size and complexity. The RFQ process also includes the pre-qualification for the mechanical and electrical subcontractor. The pre-qualified teams will then be invited to respond to a request for proposal called RFP. This RFP actually will be expected to be released in fall 2021. Building a hospital involves a process. It begins with the hospital and the Ministry of Health working together to determine the size and scope of the project, along with estimated budget. Once the project scope and the size are determined, the hospital and their team of specialized consultants develop the project-specific output specification. We call it actually PSOS. During the request of proposal period, the shortlisted teams begin the design development based on this PSOS requirement. At this stage, Infrastructure Ontario and Niagara Health team evaluate the proposals against the project requirements. Once a team is selected and a final project agreement is negotiated and signed, the winning bidder, who is called project company, from then on is announced, and construction is expected to be begin late 2022. At this point, the project company will issue a number of tenders to engage the various subcontractors and suppliers required to deliver this project. Builders typically look to employ local workers and purchase supplies locally where possible. Once the design and scope of this project has been determined, Niagara Health will be engaging with the community to create opportunities for businesses to come on board. Now, actually, I will hand it over to Cliff, who will be talk more about this.
Go
ahead.
Thank you, Adele. Thank you very much. And again, I want to stress our appreciation to Infrastructure Ontario, the community, and to the staff, physicians, and even our partners, patient partners, for helping us maintain our schedule to deliver on these dates, which are absolutely key. We've worked through COVID, and we continue to work through COVID to make sure that everyone's safe, but it's with the support of all these partners that we've been able to continue to meet our schedule. And this gives a good chance for us to actually talk about the opportunities for engagement. Over the next several months, there will be opportunities for businesses and the community to be involved in the planning process of the new hospital. You can expect to see these opportunities and take part in experience journey mapping. I particularly really want people to focus our team on the creating these maps, which are one-on-one interviews with former patients, family members, staff, physicians, and volunteers on Niagara Health to better create an experience for them in the facility and in the delivery of healthcare. There will be a development of a community committee to bring a larger lens of a perspective, respecting and responding to all aspects of Niagara. In the coming months, you'll see mock-ups and visualizations of room layouts and concepts, conceptual concepts of the future hospital. There will be a set of intense workshops, meetings, and public surveys to receive your input and feedback on design aspects of the South Niagara Hospital, categorizing the 6 streams that you see on the slide, from operational planning, functional planning, and site and building, to room level details, furniture and equipment, and facility maintenance. In relation to the procurement process, we will be developing a virtual marketplace where businesses can showcase their products and interact with the future construction companies. Once a successful project company has been selected, there will be a future trade show style event related to specific opportunities with constructing our hospital. You will hear more about these opportunities in the following months, and our benefit is that with our partnerships and by doing these online, we can continue to reach out and engage the community and our businesses and our staff to ensure that we create a successful project. Thank you.
So being project managers and architects and planners, we're very efficient on time. So we are going to get to the question and answer period of our session now. I just want to thank those who have already submitted questions. The questions that we possibly don't have an opportunity to get to, which I believe we may have some time today, we will answer on our website. We'll also email to those that were able to pre-register. We will begin by answering the questions that were sent in prior to the event. So we're just going to put those up on the screen right now. So our first question that was submitted was, what is a request for qualification or an RFQ? So I'm going to hand this over to our Infrastructure Ontario friends to answer.
Okay, I will answer this question, Mary Jane. The RFQ actually identified and shortlist project teams that have the required design, construction, and maintenance capability and experience, and the financial, as well as the financial capacity to undertake a project of this size and complexity.
Thank you, Adele. The next question is, what is the timeline of the South Niagara Hospital project? And I know that we touched on this before, but it's a very important question. So I'm going to hand this over to Cliff to answer.
Great. Thanks, Mary Jane. Before I answer the question, I'll just remind everyone on the webinar that this is being recorded. So you can always refer back to the slides on our website, as well as the timeline for the South Niagara project is actually on our website as well. So just to reaffirm what we said, in early 2021, Niagara Health and Infrastructure Ontario expect to issue a request for qualifications, or the RFQ, for the teams to design, build, finance, and maintain the South Niagara Hospital. From there, the pre-qualified teams will then be invited to respond to a request for proposal or an RFP expected to be released in the fall of 2021, a year from now. And groundbreaking is expected to occur in the fall of the winter of 2022.
Perfect, thanks, Cliff. Question number 3 that was submitted through our email. Why is the P3 approach chosen for this particular project? So I think our Adele is great, perfect person to answer this.
Okay, I will take this one too. Infrastructure Ontario has a successful track record of using a P3 model to deliver projects on time and on budget. To date, as Bruce mentioned, actually, based on the stats that he presented, we almost actually executed 49 healthcare facility in the province. So the P3 approach is generally suitable for large complex projects. However, not all projects lend themselves to this model. Before the request of proposal is issued on project, a third-party accounting firm puts together a public sector comparator to compare the P3 model with traditional delivery model. Only if the value of P3 model outweighs the traditional model and provides value for money, then the province release the RFP for this project. Thank you.
Thank you, Adele. Our next question, how has COVID-19 affected the planning of the South Niagara Hospital? I'll hand this over to Cliff to answer.
Okay, great, thanks, Mary Jane. You can approach this actually 2 ways. One is actually about the actual project, and then actually about what the actual hospital is. The first thing I've mentioned is the fact is that we've continued to plan during COVID-19, and we're continuing to move the project forward and planning for the new hospital. And we're expecting to make these timelines, which were the timelines that we had pre-COVID. So again, thank you to everyone who's participated, and as we moved most of our engagement online. The second part of the answer is actually how it's going to impact the particular project. And one of the things is that as we move forward, now than ever, the infrastructure of a hospital is an essential component ensuring that we have the capacity to respond and roll out effective infection prevention control, prevention and control measures. And one of the ways that we're doing this, of course, is that we're looking at lessons learned from the current situation at St. Catharines Hospital, which is actually has been very successful in handling the COVID experience that we've been having. And we'll be undergoing exercises to take what we've learned in response to COVID-19 and apply those lessons to our new hospital. Okay, thank you.
Getting a lot of great questions live as well, so thank you for that. Our next pre-entry question is, as a business owner operator, when should I be engaged in this project? I think this is another good question for Cliff.
Excellent, thank you. As I mentioned just on that last slide, there are many ways that the community can be involved in the planning aspects of the South Niagara project. I've described some of those earlier, but if there's a specific area that you would like to be engaged in, we ask you to email us at the South Niagara Project at niagarahealth.on.ca. So that's South Niagara Project, all one word, at niagarahealth.on.ca. And again, that email is actually available on our website, project website. The project company is constructing the new hospital is projected to be awarded the RFP in late 2022. There will be future opportunities in the coming months to be involved and learn more about the opportunities for your business to be engaged with the project. Niagara Health is committed to keeping you informed as we progress with planning. And I would say we'll keep you informed, try to do as much outreach as we can. And I would also suggest that you check back on our website to get regular updates.
Perfect, thank you. The next question is a little long, but a good one. The current St. Catharines facility operates under a P3 DFBM model, which presents potential advantages and cost savings to share resources between the two facilities. These shared resources also present a potential competitive advantage for the incumbent provider at the existing hospital. The question is, what is the project's team approach to balancing potential project savings for the taxpayer while adhering to fair public procurement policies? So I'll let Adele take this question.
Yeah, thank you, Margin. I think my answer for this question actually complement the previous answer to the other question that I just answered, but I will add to it by saying actually determining on optimal project delivery model is one of the key infrastructure Ontario process. So this process actually involved a detailed analysis to achieve the best value of money and allocating risk to the party that is best suited to manage it. Considering the current market conditions to ensure a competitive procurement process that is fair and transparent. Thank you.
Perfect, thank you. So with the assistance of Ranga from Infrastructure Ontario, we are going to go through the live questions that were submitted now. So thank you very much. A reminder, if you don't have the opportunity to submit a question now, you can through our website, or you can also go on. There will be a feedback survey following this that you can also submit those through. So I'll hand it over to Ranga and you can talk about the first question. Go ahead, Ranga.
Hi, everyone. So we've got a question come in for IO. When will we see an artist rendering of the new hospital? So I guess it's a question for Niagara Health as well as IO. When will we see an artist rendering of the new hospital?
I can take this question, Ranga. Just to confirm, actually, the renderings of the final hospital design will be made available to the public once the project company has been selected and the design process is almost complete. Not before that. Thank you.
Thank you, Adele.
The next question is, when does the shovel hit the ground? So we'll ask Adele to answer that question yet again.
Actually, construction expected to start in late 2022. However, actually, it is difficult for us to commit a specific start date and completion dates as well before project company has been selected. This company actually will include a schedule with their bid during the submission period. Thank you.
Perfect, thank you. Our next question, oh, sorry, it's Ranga. I have to take turns.
Thank you, Mary Jane. So we've got the next question. Will the Indigenous community be contacted to be involved in the construction of the new hospital? Bruce, do you want to take this one?
I can take this one too, Ranga.
Sure.
Okay. Actually, to confirm, ensuring that apprenticeship training opportunities on this project, we are available. Okay, to the Indigenous community and other group in the local community is a priority for government projects, as has been done in the previous P3 projects. IO and the hospital will work together to include the requirement for the successful project co to provide a plan setting out a project-specific approach that promotes apprenticeship training opportunities in connection with completion of the hospital project. As part of the contract, the successful team will be asked to work towards construction trade apprenticeship opportunities on the project for people including Indigenous persons and other residents of the local communities. Thank you.
Thank you, Adele. Our next question is from Keith. Thank you, Keith. Specialty infection prevention equipment from self-disinfecting sinks and auto UV bathroom, autonomous robotics, etc. will be part of the new facility. We'll let Cliff answer this one.
Great, thank you. Really great question. Right now, we're just moving into stage 3, which is really starting the technical aspects of the design. So we haven't yet got into the technical aspects of that technology, but we're investigating it with the Project Co team, or sorry, Project Co, our PDC team, and PDC standing for Planning, Design, and Conformance, our architects. And we plan to incorporate the most technology that we can that's available. And I'll also note that we're also working with the Ministry of Health as they investigate new types of technology into the new facilities. So we'll be working with that. And as we move forward, we'll be building that into the output specifications, which ultimately become part of the RFP that we'll issue next year.
Thanks, Cliff.
Sorry, I was muted there. So the next question is, I think Cliff may have answered a bit of this in the previous question, but new specs around using UVC for air handlers and induct UVC for air quality purification. Will this technology be designed with these latest technologies?
Okay, thank you again. Yes, similar to the question before, we're investigating all aspects from an infection prevention and control perspective in terms of what technology we can incorporate into the facility to create a better environment. And I will say UV is one of the things that we're talking with the Ministry of Health about right now, and in particular around the HVAC system. And what I will also say is that air quality is extremely important during episodes like we're having with pandemics and infection prevention and control. But you'll notice on one of the slides previously, when we talk about well certification, air quality is one of the 10 elements that is part of the certification. So we're very interested in the quality of the air that's produced, not only for events like we're experiencing in this pandemic, but for the ongoing operations of the facility. So thank you for the question.
So I believe the next one is also for you, Cliff, from Stan and Marianne. What in brief is room level design? So one of our slides pointed to how we are engaging, and one of them listed room level design. So can you elaborate on that, please?
Yes. So for our project, not to go too technical, but we've used that 80-20 rule where we see 80% of the rooms that have been built by Infrastructure Ontario through their projects, and they've said they've done 49 healthcare projects. We've really learned a lot about the quality for the room design, inpatient room design. So we're building on the successes of the other projects that have come before us. And to do that, we'll do site tours. We'll look at mock-ups. I mentioned the ability for the community to participate in mock-ups later on in the project, particularly when Project Co comes on. And the 20% is really about emerging technologies. So one of the things that we're looking at is around how infection control practices can be improved through the technology. So in-room design is talking about, I'll use the example of an inpatient room, the layout of the room, the technology involved in it, and how we actually operate to make sure that the patients have a great experience with their families, as well as looking at how staff, physicians can operate and protect the quality and the safety of the patient from that perspective. So in-room design is really focused on making sure that we're providing the best environment for our patients. I used the example of an inpatient room, like a bedroom. We also look at exam rooms. Ultimately, we look at all the way from medication rooms to operating rooms. And we'll go through the same process with our consultants to arrive at the best experience and the best environment for our staff, patients, families, and physicians.
Great, thank you, Cliff. Our next question is, how many teams will be pre-qualified for the pursuit phase? Is it 3 or 5? Adele or Bruce?
For DBFM, okay, shortlisted will be 3 teams.
Thanks, Adele. That was short and sweet. The next one is also towards you. You mentioned that during the RFQ process, mechanical and electrical subcontractors will also be selected. Could you elaborate on that? Would those subcontractors be selected in addition to the main contractors or as part of the 3 to 5 teams selected?
Okay, the subcontractors, the electrical and mechanical subcontractors will be evaluated as a second stage. However, each team should be coming from the original project company team. So we don't actually evaluate or pre-qualify those teams in isolation. They have to actually team up with one of the team to be able us to evaluate them, okay, in the next step of the pre-qualification stage. So they have to team up with the main contractor as a team. They cannot come in isolation.
Perfect.
I hope this is clear.
Thank you. If not, maybe the person can type in for more clarification and we can go back to that, of course. The next question is from Lori. Will this hospital, once open and running, have a negative impact on the current Welland Hospital? So I think that this is probably best suited for Angela to answer. So I'm just going to hand that over to Angela.
Thanks, Mary Jane, and thanks for the question. So the Welland Hospital will continue to stay open with a wide range of services. You know, we were out there with the community and hearing concerns that people were having. So we actually expanded the services that will be provided at the Welland site. So for example, we'll have robust programs there, including 24/7 emergency services that will include 8 to 10 observation type beds where you know, patients can wait for up to 24 hours, where the physician can decide whether the patient can go home or needs to be transferred to a higher level acute care site. We'll also have dialysis that will still remain on the site. It will be a center of excellence for eyes as it is now, so that will remain. Wide range of diagnostic services, including, you know, your x-rays, your ultrasounds, CAT scan, and a number of clinics as well that I know are important as well. So mental health and other types of clinics yet to be determined. You know, we're hoping that that will further be developed with further consultation with the community as well. And also the long-term care home will be redeveloped on the Welland property, actually a new build for long-term care, and 30 complex care patients, so those longer stay patients, will remain on the site as well, so that we continue to have care closer to home for the southern tier of Niagara, as well as the new hospital in Niagara Falls.
Thanks, Angela. We have one from Rachel. What is the status of design, i.e. conceptual, schematics, design, development? And I know both our IO and Cliff can answer this, so I'll let them argue on who wants to take this one.
I can start, and then and if Adela and Bruce want to add to it, I can. So right now we're into stage 3, which is what we have is a schematic design. But this design is not the design that you'll see as the final product. The RFP process allows, because of the design build and the finance maintain, but the design build part of the exercise, each proponent, each 3 teams will be creating their own design based on our output specifications. So the purposes of actually doing design work now is to test our output specifications to ensure that we're meeting all the requirements that we need to include in the RFP to have a successful building. And Adele, I don't know if you would like to continue or add anything to that.
Oh, that's perfect, Cliff. Thank you very much.
Great, thank you so much. We have a next question from Joy. How can I join a committee so that the seniors and persons living in Niagara have some say in what is happening? Cliff, do you want to take that one?
Actually, I'm going to send it to Mary Mary Jane. As our outreach and engagement expert, there are ways for us to actually reach out and have them go. So Mary Jane, do you want to take that question? Oh, this is great. I can hand out questions.
That's unfair. That was unscripted. It's a great question, Joy. We've been working on this quite extensively, actually. So if you have an interest in being involved, you can email South Niagara Project at niagarahealth.on.ca. As we're building and planning our hospital, we're constructing it with a view of having it built for seniors from every aspect. And we, of course, want to know and have your say. So as Cliff mentioned before, there are lots of opportunities and engagements where you can actually sit on some of our meetings and have input. We're also, as mentioned, developing a community committee where we're looking for seniors and persons representing Niagara to sit on this. So if you would email South Niagara Project at niagarahealth.on.ca, and I will personally reply to you and get you involved. So thank you very much. I'll ask the next question from Ben. Will this be a smart hospital? i.e., how heavily does technology weigh in on the new build in terms of being forward-thinking and innovative in healthcare delivery? And to get back at you, Cliff, you're up.
Thank you. Yes, so I'll sort of talk about exactly how I responded with the inpatient or the in-room design. We're building on the success of all the projects coming in front of us, including the Humber project, which was the first digital hospital. And now Mackenzie Vaughan is a smart hospital. So we're taking the lessons learned from those facilities and incorporating them into ours. We haven't used the word smart or intelligent. We've used the word connected, because one of the things that's really important for us when the hospital eventually opens is that it's connected to our patients in the community. And that's using technology to help them book appointments, help them to wayfind. We're hoping that even parking will become a much more pleasurable experience where they're actually able to look at reserving parking spots ahead of time based upon using technology. In terms of the actual building itself and the quality of healthcare, we want to incorporate all the technology that we can around patient safety and wayfinding as well. And then we'll be using technology in terms of both equipment and furniture and how it can speak to each other. There's a lot of evolution in this area, and we're building on the successes of the past projects, but I'm absolutely sure we'll be creating new grounds as we connect care and we connect to the community. Thank you.
Thank you, Cliff. Here's another question for you from Lori. I believe there was talk from local politicians that the land for this hospital is large enough to allow for expansion in the future. Is this still part of the plan?
Yes, a great question. We actually requested a 50-acre site so that we have that capability for future growth. And when we developed the output specifications, we'll be clear about that the proponents, when they design the facility, will show us how we were able to grow the critical parts of the building. This is not just a 30-year investment. This is probably a 50 to 70-year investment, just like other facilities like the Greater Niagara Hospital. So we want to make sure that we can continue to build on that. So that'll be one of the requirements in the output specifications and the RFP, that the proponents will show us how we can build on the facility and continue to grow and serve our community.
Our next question is from Norma. I believe this will be for Angela. When do you expect approval of the stage 2 submission?
Thanks for the question. The ministry has been very positive and very supportive with our progress to date. And we're actually expecting and hoping for approval shortly. So please stay tuned with that.
I have 2 more questions. So this is sort of a last minute call for anyone who has any last minute ones. So this is just a note, but Mayor Frank Campion would like Angela to give him a call in the next week or 2. So I'm just noting that
No problem. No problem. We'll set that up.
That's recorded now, Mayor
Oh.
Campion. So there is a final question, and I'll let Ranga do the honors.
So we have a question from Karen. What is the projected cost of the new hospital? Adele?
Okay, that's a good question. However, I would prefer actually to take the hard answer for that. Okay, not to release the projected cost, because we would like to maintain the fair, transparent, competitive bid to go through the actual process. So it's again like to add to that, you know, like we are working with the hospital, okay, to have the actual scope of work. To meet the Ministry of Health budget approval or budget target. However, I don't believe that we are in a stage to release any projected costs for the hospital right now. I will leave it this way, and if Bruce or Cliff want to add to this answer, feel free to add something.
No, I'm good with that answer. Thank you, Bill.
Experience.
So I see only one more on my, oh, there might be a couple more. Chelsea is wondering, how many beds is the hospital expected to have? So I'll hand that over to Cliff to answer.
Okay. The total number of beds that are planned currently for the new South Niagara Hospital is 469. Just to break that down, that's about 170 complex care. We have 30 critical care beds, and the rest of the beds will be dedicated to medical and surgical inpatient beds.
Thank you, Cliff. So we've got a couple more questions just come in. This one from Steve for IO. Will the PSOS require a net zero emission design? Adele?
Is this me or Cliff?
I'll start, and Adele. While that is an ambitious goal and one that we would like to work towards, we are looking at making sure from an environmental point of view that we're doing everything we can to achieve that target. I can't honestly answer at this point if that will be one of the outcomes. But one thing we are anticipating is that through new technology, we spend a lot of time talking about technology in infection prevention and control, but there is a lot of technology coming out to make buildings more efficient, reducing greenhouse gases. So what we are anticipating is that over the 30-year project, we will continue to work towards that goal. And one of the things that I would suggest that Infrastructure Ontario has been a great partner with is actually talking about setting goals around the reduction of greenhouse gases, as well as achieving energy targets that are above what we've seen in past projects as well. So unfortunately, I can't say that we will, but it's certainly a goal that we're working towards.
And just to add to that, actually, Cliff, okay, we have a minimum requirement, or we will have a minimum requirement with regard to the LEED, LEED certificate, okay, to obtain silver target. So that's one thing that it's mandated in our projects as well.
So I will ask a question from Joy to all the panelists. Does P3 mean that patients have to pay for services? For instance, if they need surgery, are they put on a list right away, which may mean a month and paid by OHIP? But if they pay, are they upgraded to Soonest? I heard that BC were fighting for their healthcare.
Yeah, I mean, I can start on the answer, and anyone else wants to sort of jump in. I mean, it's a good question, right? Because when you sort of hear public-private partnership, P3, what does that mean? And while our consortium, the private part of the P3 project, does have a broad role in designing and constructing the facility to meet the hospital's strict requirements, and then a long-term maintenance requirement to do preventative and corrective maintenance on the building itself, again, to the standards and requirements of the hospital. They're not engaged in the healthcare operations of the facility. It's very much in control and management of the hospital. And so the P3 private sector party are not engaged in the healthcare, and maybe Cliff or Angela may want to add to that.
Yeah, I mean, I just wanted to just reassure everyone, P3 does not mean that you need to, if you pay and you'll get service quicker. That's not it. Like it's mainly on the construction side. So I just want to reassure you, Joy, that that is not the case.
Thank you. Our next question is, what is the targeted construction time and opening date for the hospital? I know we've mentioned timelines, maybe it's worth reiterating. Adele?
I think I don't want to repeat actually the target date that Cliff mentioned at the beginning of the session. However, as we mentioned before, Julian, like we have a target date, but those dates will be finalized actually once we have the project company work, and they will give us the actual schedule to determine the actual substantial completion date and the final completion date, and after that it will be the opening date. So I cannot add actually any other date than what has been presented, but to reiterate, okay, the actual date will come from the project company once we have them on board. Cliff, you can add something to it if you want to repeat the target date that you mentioned during the presentation.
Yeah, I'll just add in there, because the slide didn't have it, but it is on our website. The day of opening or operations of the new facility is projected for late in 2026. But again, that will be confirmed, as Adele said, once the RFP has been awarded. The construction schedule will be set by Project Co, and that's the target that we're looking for. So we think it's reasonable, and we think that target is probably where we'll be once we award the contract, but it will be set by Project Co.
So just recognizing time, we do have time for maybe 2 more questions. So there's 2 questions on our well certification and having to do with leads. So I'm just going to combine them together and ask Cliff to answer these pieces. Stan and Marianne again want to know, does WELL improve or expand on the legislation in regards to accessibility? And then somebody else also asked, is the intent to achieve both LEED Silver certification and WELL certification?
Let me go with the first one, which is yes. LEED certification and WELL certification, while they overlap and they have some similarities between them, we will be actually working towards getting certification from both independent organizations. So yes, we'll be getting both certifications. The question about accessibility, does WELL improve it? From that perspective, WELL doesn't actually go beyond what would be required by the regulations around accessibility, particularly in Ontario. But what we are looking at is universal design. When I say universal design, is that making the facility accessible to all, including seniors, but also young families, and as well as just your average citizen, but really focusing on making it accessible for both a wayfinding point of view and right from the parking lot to the clinic or the bedside, wherever you might be going. That is a goal in our project. Back to one of the original slides, which was about accessibility and inclusiveness. That's where we're focusing on universal design. So while WELL is a key to creating a great environment for all who will use a hospital, we all do want to go beyond and make sure that it is accessible and inclusive.
Great, thank you so much, Cliff. We've got our final question from Melanie for Cliff. When is the next opportunity, or for you, Mary Jane, when is the next opportunity for community input? If not, an approximate timeline? at what stage of the planning process?
Great, thank you. There will
So
be
the next opportunity.
Oh, sorry.
Go ahead,
Delay.
Cliff.
Thank you. I was actually going to hand it over to Mary Jane, but I will suggest that there will be an opportunity to come up as we go to the community with the site plan application for the site. That is one opportunity. We'll be having a very similar type of town hall session around the development of the site. I just wanted to put that in. That's more of a technical aspect of the community, but actually getting to be engaged in the process. I'll pass that back to Mary Jane.
So really the timeline is now. Now is the most important part of our planning for the future hospital. So you'll actually see in the next coming weeks and months a lot of opportunities to engage, whether that's surveys or participate in meetings, which will be through our website. You'll see them on social media. So essentially the answer is the time is now, and you should start seeing a lot of those opportunities come forward through all of our Niagara Health channels. So we are going, just recognizing that it is 6 o'clock, we're going to leave the question portion open for a little bit longer. So if you didn't have a chance to have your question answered, you still have time, and we will be answering it through being registered or also on our website. So I just want to lastly hand it over to Angela to wrap us up.
Sorry, I was on mute. So thank you, everyone, and thanks for the great questions. I hope that we're able to answer them, but as Mary Jane mentioned, please continue to send those questions in. It really is important to us that we do get feedback and continued feedback. So I get really excited when I hear that our community wants to get involved in this project. It is a community hospital, so we want you to be involved. So I'm just going to give you that email address where we can, where you can send in your questions. It's South Niagara Project at niagarahealth.on.ca. And also important to us is we ask that you please complete a feedback survey to let us know if you received adequate information on the RFQ and RFP process. And also if there's anything else that you'd like us to cover through formats like this. Unfortunately, through COVID, we're zoomed to, that's kind of where we're at right now. You know, we'd love to see everyone in person, and it's certainly, you know, where our intent was, we were supposed to have this in person, but let us know if there's something in particular that you'd want us to cover, and we'd be happy to do so. The link is also provided in the Q&A section of your Zoom screen, and we'll email all those that are pre-registered as well. As Cliff has mentioned, we'll send you a copy of the presentation, and you'll see the questions and the answers as well. So this concludes our information session this evening, and I'd like to give my sincere thanks to firstly everyone who attended our online webinar, and of course your great questions, to our colleagues at Infrastructure Ontario, Bruce, Adele, and the entire Infrastructure Ontario team for your continued support of our new hospital, and of course to the great Niagara Health team for all their hard work in continuing to move this project forward, and a special thanks to Mary Jane as well for organizing all of this. So thank you, and have a great night, everyone.